Firstly, I can congratulate Consumer Council for doing a good job in terms of continuing to advocate for consumers and jog government's thinking in terms of areas. And certainly, from my perspective, since I have come into government, Suki has been kind of something that I've been focusing on a little bit, and partly to do with as the economy, as we try and rebuild this new economy, we need to challenge ourselves and think about some of what's causing ills in our country, and then tax it appropriately. And some of you may remember we brought in a bit of a sugar tax last year, and that is a message to all of us that we have a massive NCD issue in our country, and so taxation needs to respond to those kind of challenges to ensure that that everybody's doing their fair share in terms of addressing some of the challenges that are man-made, and therefore it needs some address at the taxation level. So this is another topic that I have been focusing on, and I congratulate the Consumer Council for coming up with this report, which I'm sure will be very instructive as government tries to develop policy in this area. Today we celebrate a significant occasion, World No Tobacco Day. This day, established by the World Health Organization, is a global initiative to raise awareness about the harmful effects of tobacco use and advocate for effective policies to reduce tobacco consumption. It is fitting that we use this platform to launch the Consumer Council of Fiji's comprehensive and probably comprehensive first ever report on Suki, a traditional tobacco product, and its implications on our nation's health and well-being. As I have mentioned, we all agree that NCDs is a massive issue in Fiji. Tobacco remains a pressing public concern in Fiji, with 16.6% of our population reported to smoke daily. Despite our efforts, including ratifying the World Health Organization Framework Convention on Tobacco Control Unit and enacting the Tobacco Control Act in 2010, the battle against tobacco use continues. Our focus today is particularly on Suki, a traditional form of tobacco prevalent across the rural and urban communities in Fiji. The regulatory ambiguity surrounding Suki poses a distinct challenge. While the Tobacco Control Act of 2020 addresses many aspects of tobacco control, it lacks specific regulations for Suki, creating loopholes that hinder our public health efforts. As we mark World No Tobacco Day, celebrated globally on the 31st of May, we are reminded of our collective responsibility to safeguard public health. This year's theme, focusing on tobacco and its impact on health, emphasizes the need for a unified action to combat tobacco use and promote healthier lifestyles. As the Minister for Trade, I recognize the delicate balance between promoting economic growth and protecting public health. The tobacco trade, including Suki, supports livelihoods, but the long-term health costs can significantly outweigh these economic gains. Our policy decisions must prioritize public health. At the same time, we need to ensure that through tax and trade policy, we find the right balance between revenue, trade, and the farmer welfare. The report, some comments on the report. The report highlights that 83% of respondents find Suki accessible and 89% find it affordable. This widespread availability supports livelihoods, but also perpetuates tobacco addiction and the related health risks. The ease with which consumers can purchase Suki, often from local markets or vendors, make it an attractive option, especially for those in the lower income brackets. This accessibility is, of course, a double-edged sword. While it supports livelihoods, it also perpetuates the cycle of tobacco addiction and, of course, the associated health risks. Many of the respondents, 71% actually, have switched to Suki from cigarettes due to its lower cost, indicating economic factors has had a significant influence on tobacco use patterns. This shift highlights the need for targeted public health campaigns to educate on the health risks of Suki. This economic incentive is particularly strong in the rural areas where income levels are generally lower. However, this switch does not mitigate the health risks. Instead, it shifts the burden from one form of tobacco to another, often perceived as less harmful, but actually equally detrimental. Although some of the respondents are aware of the health risks posed by Suki, there remains a misconception that it is safer than cigarettes. While 55% of the respondents were aware of the health risks associated with Suki use, a significant portion, about 28%, believe that Suki has lower health risks compared to cigarettes. This complete lack of awareness necessitates targeted public health campaigns to educate users about the potential health consequences of Suki consumption. The misconception that Suki is safer than cigarettes can undermine efforts to reduce tobacco-related harm. Public health campaigns must address these myths directly, providing clear evidence-based information about the risks of all forms of tobacco use, including Suki. The government recognizes the economic importance of the tobacco trade, including Suki, in providing livelihoods to farmers, vendors, and supply chain stakeholders. However, it is also aware of the long-term health costs associated with tobacco consumption, including healthcare expenses and lost productivity due to tobacco-related illnesses. To balance these competing interests, the government is committed to implementing a comprehensive approach considering the tobacco industry's economic benefits and public health implications. This includes investing in public health measures to reduce tobacco consumption, such as awareness campaigns, smoking cessation programs, and tobacco control policies. Furthermore, we are exploring strategies to diversify the economy and create alternative livelihood opportunities for those dependent on the tobacco trade. This may involve supporting farmers transitioning to other sustainable and healthy agricultural practices, promoting alternative crops, and providing training and resources for individuals to pursue new economic opportunities. By taking this holistic approach that considers both the economic importance of the tobacco trade and long-term health costs, the government aims to strike a balance that promotes economic growth while safeguarding health and the well-being of its citizens. We need to create a sustainable and prosperous future for all through this balanced and strategic approach. NCDs, or non-communicable diseases, are a major health burden in Fiji, accounting for over 80% of all deaths. Tobacco use is one of the risk factors for many NCDs, including heart disease, stroke, cancer, and chronic respiratory diseases. The economic costs of NCDs are enormous, encompassing healthcare costs, lost productivity, and the financial burden on families. By addressing tobacco use, particularly Suki consumption, we can make substantial progress in reducing the prevalence of NCDs and improving the overall health of our population. The findings of this report underscore the urgent need for comprehensive policy interventions. Strengthening our legal framework is a critical first step. Amending the Tobacco Control Act to explicitly include Suki within its regulatory scope will ensure it adheres to the same advertising bans, labeling requirements, and health warning regulations as other tobacco products. Additionally, mandating standardized packaging for Suki will facilitate the inclusion of health warnings and information about nicotine content, empowering consumers to make informed decisions. Public health campaigns are vital in raising awareness about these risks of Suki use. These campaigns must actually be culturally sensitive and targeted, especially towards young adults who are the most vulnerable to starting tobacco use. Schools, community centers, and media platforms can be used to disseminate information and promote tobacco-free lifestyles. Let us all commit to a future where tobacco use in all its forms is significantly controlled. Let us strive for a healthier Fiji, where our people can lead stronger, more fulfilling lives, free from the burdens of tobacco-related diseases and NCDs in general. Thank you, and I look forward to the insightful discussions during the panel on Suki versus cigarettes, the impact of tobacco choices in Fiji, and I wish to congratulate the Consumer Council and CIMA for this report, as it does bring the flashlight, if you like, on one of the key drivers of NCDs in our country, in our life.